for Timmins, James Bay.
Thank you, Mr. Speaker. If anybody wants to see the deterioration and disappearance of public health care, come to Ontario. Last year we had 1,000 emergency closures. This year it's going to even be higher. Now, if the poor emergency wards could only sell Budweiser, they might get the attention of Doug Ford and his grifter government, who are more interested in beer cans than they are in health care. I raise this because of my concern that while we're talking about improving health care for every Canadian, we see one party, the Conservatives, steadfast against it. We see the record of Conservatives in province after province after province of undermining, threatening, attacking public health care, and here they are standing up in the House day after day attacking pharmacare. At least with Doug Ford, we know we're going to get a can of beer out of it. With this government, with the Conservatives, we are going to get totally rooked.
The Honourable Parliamentary Secretary.
Well, thank you very much, Speaker. I thank the member for his comments, and I'm sure he knows my view on Doug Ford's government and how we can be better served here in Ontario. When I was knocking on doors in last election, one of the messages that I was given to me repeatedly by my constituents is to work with all members of this House, to work with all political parties. My constituents were absolutely clear to me on that, is to ensure to get things done. And I'm really glad that we have found a common path with the NDP when it comes to introducing pharmacare, when it comes to introducing Canadian Dental Care Plan. Because in my riding of Ottawa Centre, and I'm sure it's true in all constituencies across the country, that's what Canadians want. Our politicians to work together to find ways of improving their lives. This legislation will do this. It will ensure that for once, Canadians starting to get access to pharmacare. This is a framework legislation that starts with contraceptives and medications that is going to improve the lives of millions of Canadians.